Villagers, your boy Dr. Ross back here again. And I had an interesting interaction recently, so I decided to make a short video. So basically, somebody came in and they were having fever, cough, and it's been happening for more than a week. So I gave them some antibiotics. So I wrote up for some panadol, some cough syrup, antibiotics, some vitamin C, right? And assessed the person, reassured them, tell them this is what they need to take, use it for a week or so. Come back and check me. Let me see how you're feeling. I gotta listen back to the chest, listen back to the lungs, make sure everything is fine. Now this person also has diabetes as well. And the person said one thing interesting. And what they asked, or what they were saying was, right, so I'm going to use this medication for a week and then start back my diabetes tablets. So then I was like, no, slow down. You're taking your medication, right? So continue your aspirin, your metformin, and your whatnot. But I want you to continue, right? Make sure and continue your regular meds in addition to what I'm giving you right now for this little infection that you are having, for this cough and cold infection, right? This respiratory tract infection. And the person, basically when I inquired a bit more, it seems as though whenever they got sick, they should put a hold on their regular medications, use this course, for our next few days or a week or so, and then start back the medication. Whenever you go to your doctor, make sure and tell them what you are currently using. Sure, I might be careful giving people lots of strong NSAIDs if they're using some very strong blood thinners. Or I might, if you're a heart patient, I'll be careful with certain antibiotics and lots of other meds. Interactions with other medications, enzyme interactions. Right, so, if you're using aspirin, metformin, and I add on some panadol, a cough syrup, and some antibiotics for a week, once I know what you are currently taking, once I know about, your pressure, your sugar, your heart, the kidneys, what you're currently on, what you're allergic to, I would choose the best combination of medications for you. Your panadol, the cough syrup, the antibiotics, to make sure that there's no interaction. Or I might even tell you, okay, if you're taking this on an empty stomach, you might feel a little upset. Or you know what, hold off on this one, complete this course, and then resume. That's what, us as responsible doctors, that's what we would do. So this person had the misconception that when they were using these medications, stop using the metformin, stop using the diabetes medication until they could resume these other medications. And another thing, two things like steroids, prednisolone and dexamethasone. Some people, they don't want to take it because it will send their blood sugars up, and then they say, they usually want to carry down blood sugar, and we're giving them something else that will help with the cough and cold infection that will carry up the blood sugar, and they don't want to take it. And so it's a whole discussion that we need to have. But again, if your doctor prescribes you medications, right, just confirm with them, is it safe to take with my current existing medications? 99.9% of the time, we will say yes, unless it's something specific that we want to stop temporarily, and then you go back to it once you finish a course. It depends. It's a case-by-case basis. Let your doctor decide. But for the majority of people, right, again, confirm with your doctor. If we give you a short course of panadol, vitamin C, cough syrup, and antibiotics, most likely you have to continue all of your pressure and sugar medications, aspirin, etc., unless your doctor tells you otherwise, right? Some people get sick and they start using some meds and they're not sure if they should take their regular pressure and sugar medications, and they hold off on it, right? And then your pressure and sugar goes out of control, or you lead or the high sugars and they lead to other complications while you're already sick, right? And you can end up in hospital or worse. So again, tell your doctor what medications you are taking and just confirm with them that you're taking everything together. Most likely, or unless your doctor says otherwise, continue regular medications in addition to what you're using now. Villagers, you all keep safe.